Hello there, Miss Taylor. How are you doing today?
Well, it's been rough trying to communicate with my daughter, especially since the first therapy session last week. It was like pulling hair getting her to come today. I don't know if this therapy is going to improve our relationship.
This session is going to address and answer to a lot of those concerns, doubts, and questions that you may have. You could consider our time together today an informational session. I want to speak with you individually for a little bit about how Millie's treatment will progress, and then I will speak with her individually. As we progress further into treatment, I might facilitate joint sessions. Millie should become increasingly comfortable in sharing sensitive information with me, and as I help her to learn how to cope with the feelings and thoughts associated with the trauma you told me about during the first session, and teach you more about what may be going on inside her, the communication between you two at home should improve, and joint sessions will be more beneficial. As a team, we can successfully treat Millie's symptoms, even if it is just one symptom at a time. You are a very important figure in Millie's life and a valuable resource for her recovery. You have already proven to be very valuable in your daughter's life. You persuaded her to come in for treatment. If the treatment is done earlier in one's life, there is a better chance for long-term problems to be prevented. What also makes you a key figure in Millie's recovery is your role as caregiver. Millie still lives with you, and she depends on you. She cares about how you see her, and as much as it doesn't seem like it, she hears what you say and respects your opinions, values, and beliefs. I too respect your value system and want to hear your thoughts and assessments of what we are discussing throughout treatment. Treatment is collaborative, and it is one of my goals to meet yours and Millie's expectations at all times during our sessions. And I encourage you to discuss information you have learned in our parent sessions with Millie at home in your own words. This extends the treatment process outside of these four walls and increases the chance that we will reach most of our goals within a few months. It will also improve the relationship you have with her and help her to feel more at ease with the parent sessions. I imagine that at this point she is feeling indifferent about us talking about her without her around. I have 12 to 18 sessions to facilitate what is called trauma-focused cognitive behavioral therapy with Millie and yourself, and that is usually a good amount of time to make a significant amount of progress. But it may not be enough time for Millie to have become completely comfortable in communicating openly with you about what happened or about anything associated with the trauma. So you must try to be patient with her. Just remember, she is almost a grown woman, and what happened might have set her back some emotionally. She is probably feeling ashamed, guilty, and embarrassed, and these are all feelings and thought processes associated with post-traumatic stress disorder. According to my assessment of your daughter thus far, she meets the criteria for PTSD. She is demonstrating post-traumatic stress reactions. Millie was raped. Her physical integrity was threatened. I have been referring to the rape as the event or the trauma and will continue to do so during our sessions. A trauma is defined as an emotionally painful, distressing, and at times shocking event that may result in lasting mental and physical effects. Millie's response to the trauma seemingly involves a sense of fear and helplessness. She is experiencing frequent nightmares and quite possibly distressing dreams of the event, although the content may not be recognizable. Nightmares are quite often caused by avoidance. She doesn't want to talk about what happened. She is avoiding what happened. This is causing a vicious cycle of distress within her body and mind. Anytime she is faced with something that reminds her of the event, she is experiencing a very high level of distress. She has begun to experience recurrent thoughts about and recollections of the trauma, and even flashbacks, especially at night. This means her sleep is almost always being affected by conscious and unconscious negative thoughts and feelings associated with the trauma. She is frequently feeling anxious and worried, and it may be consuming her, affecting her ability to focus in school or lead a normal social life. Millie needs to know that what happened to her is not her fault, and you can help me empower her to understand and believe that truth. But you must first understand and believe me when I say that what happened is also not your fault. Together we can help her to understand her symptoms and recognize her strengths. But again, she needs to see your strength. Although she is almost 18, you still have the ability to significantly impact her adolescence, a very impressionable and important developmental stage. One of the biggest topics for discussion as an adolescent is sex. It is important you're able to openly communicate with Millie about sexual issues, as uncomfortable as it is for you two. It is my hope that our sessions will decrease the discomfort surrounding this topic. She needs to know that it's okay to be curious about things like birth control and sexual desires, but she also needs to know what constitutes frequent and indiscriminate sexual activity, a common effect of trauma in adolescence. Millie might need guidance in setting boundaries and maintaining them. She needs to know how important boundaries are. Millie and I are counting on you to take the initiative. Believe it or not, you are one of Millie's essential role models, and if she sees you taking the initiative, not only will she see how much you care, but she will be more likely to take the initiative in future situations, therefore reducing the risk that she be re-victimized. We will talk more about risk reduction for re-victimization and safety skills later. Let's talk more about how trauma-focused cognitive behavioral therapy helps to address the issues we have discussed thus far. This kind of treatment is trauma-specific and directive. Non-directive treatment doesn't help to reduce avoidance. Ideally, TFCBT will extinguish the negative automatic responses Millie experiences when triggered to remember the trauma. She will be expected to complete various homework assignments, one of which is a chart used to measure her feelings. One of the first challenges Millie must face in treatment is learning how to identify her feelings and thoughts and how they are connected to particular behaviors she exhibits. She needs to be able to demonstrate this skill in and out of this office. TFCBT will help both of you identify a wide range of emotions and learn how to cope with them. It's going to be emotionally trying for both of you to face these challenges. It is going to be especially difficult for Millie to face the trauma head-on. This is why TFCBT incorporates personalized stress management skills, like deep breathing techniques. We will discuss that during our next session. What is most important about this treatment is the incorporation of the trauma narrative. This will be the most difficult task for Millie to undertake, but she needs to be able to share all of her traumatic experience either verbally or in written form. A lot of people find it easier to write the narrative, at least before they verbally share it. This is why I gave her a journal last session. Once she has accomplished writing and or verbally sharing a trauma narrative, she will repeat this narrative until she is bored with it. This repetition bores the client out of excessive worrying. Millie and I will collaborate on what worries her most and which goals are most important to her, and this ongoing process will guide the treatment from session to session. Throughout treatment, I will help you and Millie to identify inaccurate or unhelpful trauma-related thoughts. This is especially important as you may be faced with difficult questions or issues that arise when you and Millie are at home together. Like I have already discussed, Millie thinks she is at least partly to blame for what happened. Because the offender is Millie's father, he might have easily manipulated her into thinking what he was doing was okay, or that he was doing what he was doing because she was not a good girl. Different influences in society tell us that the victim must have done something to cause the abuse. This is not a fact and is one of many myths. Another commonly held societal myth is that if a child or adolescent did not try to stop the offender, he or she consented. Millie probably feels guilty for not trying to stop what was happening or for not being able to. As Millie becomes attuned to the fact that she is a victim, she needs to feel protected, not blamed or isolated. Many parents become easily frustrated and they stop listening when their children do not know how to appropriately express their feelings and thoughts. But this is normal and she must know that. So you must always listen. And the more you listen, the easier it will become for her to express herself appropriately. You can help her label her feelings, which will also help to normalize what she is experiencing inside. She feels alone, and her feelings are confusing to her right now as it is. Helping her to identify and label her feelings could be one of your ongoing homework assignments if you are comfortable with the task. If you are still not convinced that TFCBT is most likely the best type of treatment for Millie at this time, I will share some general facts about the popular approach. There is a significant amount of sound scientific evidence that TFCBT helps adolescents overcome many of the difficulties associated with abuse and trauma. I encourage you to look in mental health journals, where you will see multiple randomized, controlled clinical trials conducted by various research groups, demonstrating that TFCBT is better than no treatment or good comparison treatments in reducing commonly experienced symptoms associated with trauma. I appreciate your listening to me, and please know that there is much more information out there on trauma, PTSD, and TFCBT. If you are interested in reading material on trauma, its effects, its prevalence, you should take a look at the Child Sexual Abuse Handout. It includes a good amount of empirically supported information outlining parenting issues. For a more extensive outline of post-traumatic stress disorder, read this segment on it in the Diagnostic and Statistical Manual of Mental Disorders. Do you have any questions? Thank you for your time. Now it is time to meet with Millie for a while. Hi there, Millie. Thank you for allowing me time with your mother. She is very interested in helping you feel better. Are you ready to begin our second session?
I guess I have to be. I still don't really feel like talking about this.
We will talk about it when you are ready to talk about it. Today, let's just talk about how we are going to treat your negative feelings and thoughts so that you can lead a happier life. These negative things going on in your body and mind can also be described as symptoms. And your symptoms, like the excessive guilt and recurrent negative thoughts, meet the criteria for post-traumatic stress disorder. I believe that an event has traumatized you and has rendered you helpless and fearful. You do not have to feel afraid or helpless, but these feelings are normal. I also believe that you are avoiding what happens, and that may be why you are experiencing frequent nightmares and recurrent thoughts. If it is okay with you, I would like to treat your symptoms with trauma-focused cognitive behavioral therapy, a treatment model widely used in treating children and adolescents who have been traumatized and are feeling depressed. One of the most important components is the trauma narrative. As we progress into treatment, I am going to encourage you to share all of your traumatic experience, either in written or verbal form, whatever makes you feel more comfortable. Once you are comfortable enough to share it once, you will be able to repeat the narrative, and the goal is for the repetition to bore you out of worrying about what happened. Now I know this will be nearly impossible to do it if we don't make sense out of the way you are feeling and thinking first. I will help you learn how to identify your feelings, and then help you learn how your feelings, thoughts, and behaviors are connected. We will also discover what triggers you to shut down or feel anxious, and I will help you learn how to cope. You're probably wondering how you will ever be able to face what happened and not shut down or feel overloaded with stress. I'm going to teach you stress reduction techniques like muscle relaxation. I will encourage you to demonstrate this technique next week during our third session in hopes that you will be able to demonstrate it at home or even at school as a means of coping with stressful situations. But you will also learn to cope with the stressful situations by using your strengths. You need to be able to recognize your strengths, and I will help you identify them. I will provide you with homework assignments that we agree upon as a team. I want you to consider filling out this mood and activity charting form. It will help you identify what causes you to feel what you are feeling and why. Please know that I want you to feel welcome in openly communicating with me about anything at all, even if it has nothing to do with what happened. We need to build a trusting relationship. Your mom wants you to be able to trust her as well. I know she may act indifferently towards you at times, but this is a learning process for her too. That is why I'm going to meet with her individually as well. The TFCBT model should last us about 12 to 18 sessions, comprised of individual and joint sessions. I will facilitate joint sessions when you are comfortable sharing information about what happened with your mom as well. I am confident that TFCBT is the answer to your presenting problems, and I'm excited to work with you. Do you have any questions? Millie, thank you for your listening and for your time.